As we move towards the end of the 15th week since the COVID-19 lockdown in the UK, I wanted to update you with just the latest news from PACE. Firstly, I'm really pleased to say that we've continued to respond proactively and innovatively to maintain our services during this period of lockdown, developing some really new ways of working across both our academic and therapy delivery. Our children, families and staff have enjoyed engaging with regular live lessons through Google Classroom and teletherapy through Microsoft Teams. And I'm indebted to the creativity and hard work of both our staff and our parents and carers in making that delivery possible. In recent weeks, we've also been working hard to distill and apply the ever-changing and sometimes contradictory advice from the organisations that govern and inform our work. The Department for Education, the Royal College of Nursing and the therapy colleges, together of course with wider government advice by the NHS and Public Health England. We know that the risks of not receiving face-to-face therapy and social interaction are beginning to outweigh the risks presented by COVID-19. For the babies and toddlers in our child and family services, 15 weeks without hands-on therapy input is a really long time during a period of such rapid growth and development. And for the children and young people in our school services, despite our innovative online delivery, they very much need to get back to the face-to-face physical activity and social interaction that underpins our provision. We also recognise the strain and pressure on our families, working to support their children, not just as parents and carers, but also as teachers, therapists and nurses, as they support the delivery of our programmes remotely. Therefore, the government's recent announcements, which reduced restrictions on those who are shielding from COVID-19, and which reduced social distancing requirements from 2 metres to 1 metre plus from July the 4th, have come at an important time for all of our children, young people and families. And so I am really delighted to confirm that we are reopening our doors to welcome children back into our child and family service from Thursday, July the 2nd, and that our school will reopen using part-time, self-contained bubbles of children and staff on July the 6th. That reopening comes after a very careful assessment of the relative risks and the implementation of some very specific risk mitigation measures, a summary of which can be found on our website at thepacecentre.org. As the world evolves and advice changes, the phased approach that we've adopted will allow us to flex and adjust, keeping our children and their needs firmly at the centre of all that we do. And before I sign off, let me also say that we've been overwhelmed by the well wishes, donations and support from across our community during this challenging period. I want to thank you personally for your kindness, your generosity and your support. And we will, of course, keep you up to date with progress in the coming weeks and months. Thank you, and please stay safe and well.